name's Mercedes. I'm going to be your nurse today. I hear that you're having some difficulties breathing and having some respiratory distress. Okay, well, can I get your name and date of birth? Great. So let's go ahead and take your vitals to start. Go ahead and take your blood pressure. Wait for that for a couple minutes here. And it does look like you're reading at about 89% for your oxygen. So I'm just going to go ahead and take a listen really quick. All right, and now you're back. Alrighty, now I do hear some crackles and wheezing on your posterior side, and your anterior side seems pretty clear. So I'm going to go ahead and consult with my doctor and see if we can get you some order for some oxygen. And now that I've got my order from my doctor for the oxygen, I'm going to go ahead and apply my nasal cannula. I'm going to hook that up and set it to my doctor's order. How's that feel around your ears? Feel okay? Awesome. And if there's anything else that you need or have any questions or concerns, just ring your call bell and let me know. And now I'm going to document what I've done with my patient, perform some hand hygiene, and we are all set. Alrighty, so now that I've identified my patient via the name and the date of birth with their wristband, and I've donned my sterile gloves, I'm going to go ahead and start performing my trach sectioning. So I'm okay, I can go ahead and I can set up, attach my catheter to my suctioning device, and just make sure that that's working okay. Looks like it's working well. Alrighty, and I'm just going to ask you to kind of take a couple deep breaths for me so we can go ahead and remove the old trach tube. Okay. Discarded that. I'm going to have you take just a couple more deep breaths. Okay. Alrighty. A couple more deep breaths for me. Okay. And one more time, just a couple more deep breaths for me. All right. So now that we're finished with that, I can go ahead and discard that and turn off my suctioning device. And so now I'm going to get a trach the same size or a size smaller as the one that I had pulled out. Take a couple more deep breaths for me, and I'm going to go ahead and insert that in until I hear the click. Alrighty, there's the click. Put the mask back on. And I'm going to ensure that your balloon is all set. All right, looks good. I'm going to go ahead and don my gloves and discard those. Perform my hand hygiene. And we're just going to kind of reassess your vitals really quick and make sure that the suctioning has helped. And it does look like your O2 is back up to about 92%. So it does look like the suctioning has worked. So I'm going to go ahead and document what we've done today, and you are all set. Alrighty, so now that
Hi, my name's Mercedes. I'm going to be your nurse
today.
today.
Can I just start off by getting your name and date of birth?
I perform my hand hygiene and I've donned my
Good.
gloves.
So today
I'm
the doctor's
okay to
ordered
go
that
ahead
we
and
go
begin
ahead
the
and
procedure
change
that I'm
your
going to
inner
do,
cannula,
which is the
and your
doctor
dressings
dressings
on your trach.
have those to my section.
So while I'm kind of prepping here, are you having any difficulties with your trach? Difficulties
So let's
changing
go
it,
ahead
anything like that?
and we will take our catheter, hook it up to our suctioning device.
So first I'm just going to start off
Make
by
sure
asking you to
that's
take a
working.
couple deep breaths so I can go ahead and change your cannula. Make sure that it's working. Okay,
Looks like it's working.
and
So
I
I'm gonna
would
go ahead and
replace
ask
that with
you
a
to
new
take
one
just a
of the
couple
same
deep breaths
size.
for me. Lube
Wait
that.
for the click.
nose down.
She's
You're gonna
all
go
clipped
through
in
your one
there.
nostril
And now I'm
first.
just gonna go ahead and remove your old dressing as well
Good.
and replace that with a new one. Take a couple more deep breaths for me. First, I would clean it with my Q-tips. Clean all up underneath there. A few more deep breaths and get a new Q-tip.
Your mouth.
Discard that as well. Now I can go ahead and put my new dressing on. That would stay on the patient. Then we're going to go ahead and discard of our catheter. All right. And now we're also just going to change your straps. And I'm just going to reassess your vitals off and make sure that your strap has risen. Put it on. The suctioning. Give that just a second here. Alright, and it does look like your O2 has risen back up to a 92%. So it looks like the suctioning has helped. If you have any questions or concerns, just ring your call bell, and I'm just going to ensure that that's tight enough. I'm just going to document what I've done with my patient, perform my hand hygiene, and we're all set. Alright, now I'm just going to don my gloves, perform my hand hygiene, and document what I've done with the patient. Hi, my name's Mercedes. I'm going to be your nurse today. Can I just start off by getting your name and date of birth? Good. So today the doctors ordered that we go ahead and change your inner cannula and your dressings on your trach. So while I'm kind of prepping here, are you having any difficulties with your trach? Difficulties changing it? Anything like that? No? Good. Okay. So first I'm just going to start off by asking you to take a couple deep breaths so I can go ahead and change your cannula. Okay. And I would replace that with a new one of the same size. Wait for the click. She's all clipped in there. And now I'm just going to go ahead and remove your old dressing as well and replace that with a new one. First, I would clean it with my Q-tips. Clean all up underneath there. Discard, get a new Q-tip. Discard that as well. Now I can go ahead and put my new dressing on. Alright, and now we're also just going to change your strap. Take that off, grab a new strap, put it on. Ensure that that's tight enough using 2 fingers. Alright, now I'm just going to don my gloves, perform my hand hygiene, and document what I've done with the patient. So today we're going to be going over our oxygen delivery devices. Room air is always 21% oxygen, 1 liter is 24% oxygen, 2 liters is 28% oxygen, and it continues to go up by 4% with every liter that you give. Our first mask, we have a nasal cannula. And as you can see, this is how it would be placed on a patient, and this is what it looks like off of a patient, and you can administer 1 to 6 liters through that. Second, we have a Venturi mask. With the Venturi mask, you can administer 1 to 15 liters of oxygen, and for the green dial, it's less oxygen, and the blue dial, it would be for more oxygen. Third, we have the non-rebreather mask. It would have 2 flaps, and you would not give this to a CO2 retainer because it could potentially suffocate them, and you can give 10 to 15 liters through this mask. And then for a partial mask, you would also keep this mask on them, although it would only have 1 of the flaps, and you can administer 8 to 15 liters through this. Next, we have our simple mask. As you can see, it doesn't have a bag, and it's just the mask, and that's how you would place it on a patient, and you can administer 5 to 8 liters with that. And lastly, we have our trach mask, and you can administer 10 to 15 liters of oxygen through that, and you would just place it right over the patient's trach.